crying little.
People, a very beautiful morning, beautiful afternoon, and beautiful evening to every one of you. How are we all doing, guys? I know we're doing amazing. All right, so in today's video I will be teaching you A to E assessment of a GCS patient. I know you are excited. I've gotten several mails. Please, can you do a video of A to E assessment of a GCS patient? It is well. Today we're going to be doing that video, right? Before we dive into the video, I am excited. I got several messages this week. If you have been following me, or rather you subscribe to this channel, you would have seen a lot of messages on this channel. Congrats to those who have passed. For those of you who are writing soon, you are definitely succeeding. All you need to do is to practice well. OSCE is simple and nurses are brilliant. All right, so if you're meeting me for the very first time, my name is Violet Okolocha. I'm a registered nurse. I live and I practice here in the UK. And on this channel, I talk about everything to make you pass your OSCE exam in one attempt and some positive vibes here and there. So please subscribe to this channel. And for those who have been subscribing, my returning subscribers, thank you so much. So guys, come with me and let's get started on A to E assessment of a GCS patient. So like I always say, in some centers, because you will be having a live actor, you will be having a live patient, in some centers, they make you wear apron and glove. So you do your hand hygiene first and they make you wear apron and glove before you approach your assessor. So I'm going to act like that today. So if your center doesn't make you wear apron and glove before you assess the live actor, as you enter, you do your hand hygiene, you relate with your patients, you leave them with the call bell, and you go and put on your apron and glove and get your equipment to start. But in today, I'm just doing it for those. So whichever you have, it really doesn't matter. If you happen to have this scenario where they make you do your hand hygiene first and wear apron and glove before you meet your assessor, is also fine. So I'm acting like that in today's video. So come with me and let's dissect A to E assessment of a GCS patient. Even if I'm with my apron and I'm with my glove, my assessor has welcomed me and she has told me I'm doing A to E assessment of a GCS patient. The first thing I will do now with my glove hand is to do my hand hygiene. So assessor, I'll do my hand hygiene according to World Health Organization. Palm to palm, right palm over left bosom, vice versa, fingers interlaced, fingers interlocked, fingers interlocked, rotation of the thumb, tips to the finger, and the wrist. So my hands are clean. I always say to my online students, after hand hygiene, read your scenario. So I'll read my scenario just so I know what patient I'm having. Am I having a GCS patient? Am I having a cardiac patient? So it's really important you read your scenario. If you write it, you just have an idea. All right, so I've gone through my scenario. I know I'm having a GCS patient. So now I will proceed to my patient. Hello.
Hi.
My name is Violet. I'm one of the nurses who will be looking after you today. Are you all right?
Yeah, my head is aching out actually.
Oh, bless you. How is your head aching?
It's paining me.
Oh, bless you. I'm so sorry to hear about the pain you are having. All right. So can I ask you to score your pain, 0 being the least and 10 being the highest?
7.
Oh, that's quite high. Can you take a deep breathing breath for me?
Okay.
Can I pop up the head of your bed?
Okay.
How do you feel? Is it worse?
No, it's still the same pain.
Oh, I'm so sorry. You know what? I'll continue with my assessment if you are able to bear the pain. Okay. After my assessment, I will escalate to the doctor so that we can get something for your pain. Is that okay with you? Are you happy to bear the pain?
Okay.
All right. So can I just confirm with you your full name and date of birth, if that's okay?
Okay. My name is Haley Brooke.
And your date of birth?
19th February.
Okay.
2014.
Okay, fantastic. Can I double check that with your wristband?
Okay.
Remember what I always say. Make sure you're looking at your paperwork and you're looking at the wristband. So I have here Haley Brooke, date of birth 15 February 1940. Hospital number 10010. Assessor, I have to write patient. So Haley, can I confirm with you please? Do you have any allergies at all to food, latex, adhesive?
Yeah, I'm allergic to nuts.
Oh, bless you. When you take nuts, what happened to you?
I usually have rashes all over my
Oh, I'm
body.
so sorry to hear that. That's why you're having a red wristband.
Okay.
Nobody will give you anything containing nuts. Is that okay?
Okay, that's
All
fine.
right. So, Haley, the reason I'm here this lovely morning is because I want to assess you using your GCS2 assessment chart. Is this a convenient time for me to do that?
Yes, it is.
All right, fantastic. So what I'm gonna do, I will leave you with a call there while I assemble all the equipment I need to carry out this assessment. Is that okay with you? All
Okay.
right, fantastic. So if you need anything, use your call bell or give me a shout. All right.
All right.
So assessor, I'm supposed to be taking off my apron, taking off my glove, do my hand hygiene, put on another apron or another glove. Your assessor is going to tell you go ahead. So can you tell me go ahead?
Go
So that's
ahead.
what your assessor is going to tell you. Okay. So assessor, can you confirm all my equipment is clean and ready for use?
Yes.
All right. So Haley, I'm back. I always say to my online students, always start your assessment of GCS serially according to the chart so that you don't make any mistake. So Haley, I'm back. Are you still happy for us to continue?
Yes, of course.
Bless you. So Haley, because we have been interacting, I've asked you your name and your date of birth and you've been telling me. I can confirm that your eye opening is spontaneous. All right. So I'm just going to code that quickly. All right. And so for your verbal response, I'm just going to ask you, do you know where you are, Mrs. Ellie?
Yes, I'm at the supermarket right now.
Really? What are you doing in the supermarket?
I'm just going to get some few things to cook.
Oh, bless you. So, Haley, you're not in the supermarket, you are in the hospital. You actually had a fall.
Oh, really?
Yes, that's what happened. So, I'm so sorry about that. So, you're in the hospital, you're receiving treatment because you had a fall. They've done a CT scan and they've diagnosed subdural hematoma. I'm sorry about that anyway, but you're receiving treatment now in the hospital.
Okay.
Do you remember any of such incidents?
No. I actually remember that I had a fall.
Oh,
I
bless
don't know
you.
where I got here.
Anyway, not to worry. You are here for us to help you. So we will do our best to make sure we do everything within our reach to help you. Okay?
Okay.
All right. So because I've just assessed you, I'm going to take 4 on verbal response. All right. But I've oriented you now to time, place, and person. So Haley, can I ask you to do something for me?
Okay.
Can you pop out your tongue for me?
Okay.
All right. Can you raise your hand for me? Fantastic. Well done, you. So you obey command. That's good, good, good. So Haley, I'm just going to do a full set of observations on you. Is that okay?
Okay.
Have you ever had surgery on your hands, please? This hand. Have you ever had
No.
surgery on this hand? Can I just take off your sleeve slightly? Is that okay?
Okay.
All right. So you've never had surgery on your hand previously, okay? That's fine. Sorry, darling. Okay. I think this will do for me. All right. All right. So Haley, I'm just going to tie the scarf 2 to 3 centimeters away from the cubital fossa. Is that okay?
Okay.
All right. So when I tie the scarf, I'm going to assess your knee bends. All right.
All right.
Okay. Pop your hand here for me, my darling. All right. So guys, let's see how it goes. So before I put the machine on, can I see your knee bed? Please don't mind my son. He's actually training his knees, but you wouldn't meet an actor that is training their knees. All right, I can see your knee beds. There are no cyanosis. There are no false knees. It's properly perfused. I'll do a capillary refill. It's less than 2 seconds. I'm happy with that. So I'm just going to put my probe, all right? Imagine the probe. So I'm going to put my machine on now. So while that is reading, I'm just going to put my patient's name, Haley Brooke, hospital number 10010, date, time, candidate's name is my own name, So guys, make sure you check properly your chart. Look at your chart. Make sure you write the patient's name if it's not been written for you, the patient hospital number, the date, the time, and there's another column for time. So make sure you write that all right. All right, Haley, thank you very much. I now have your blood pressure and I now have your saturation. All right. Thank you so much for your cooperation. I'm just going to chart that quickly now. One 10 over 54. All right, and the saturation is 96. All right, so Haley, can I please count your pulse for complete 2 minutes? Is that okay?
Okay.
Please, can I have your watch? Sorry. Thank you very much. So GCS is so simple. I'm just going to be counting. Please, guys, count your pulse for 2 minutes. Some assessors can fail you because you counted less than 2 minutes. Remember, pulse is 1 minute and respiration is 1 minute. All right. So immediately you finish counting the pulse for 1 minute, make sure your fingers are still there, but you're now looking at the rising and the falling of the chest. All right, thank you very much. So I'm just going to chart that and I'll come back to you quickly. All right, so Haley, I actually counted your pulse for 1 minute and I counted your respiration for another 1 minute. But I didn't want to tell you because sometimes when we tell patients we're counting their respiration, it alters the reading. I hope you don't mind.
Yes,
Fantastic.
Okay.
Can I check your skin, please?
Okay.
I can see your skin. There is no excessive sweating. There is no redness. I'm happy to take my temperature, all right?
All right.
So I'll just take your temperature. Don't be scared, my darling. Fantastic. 37. So our chart 37. All right, thank you very much. So Haley, I'm just going to be checking your pupils. Is that okay?
All right.
All right, so can I check your pupils, please? All right, fantastic. There are 2 ways we can do this. Is either you get your eyes fixed on my forehead, or you use your right hand to cover your right eyes while I assess your left eyes. All right, and when I'm done with the right, you use your left hand to cover your left eyes while I assess the eyes, the right eyes. Which one do you want to do?
I'll just fix my eyes on the forehead.
Okay, so go ahead, darling. So assess the first of your eyes and let's get this sorted. So I'm going to be putting my pen light from the outer cantos to the inner cantos. All right, thank you very much. I'm going to do the same from the outer cantos to the inner cantos. All right, fantastic. Thank you very much. All right, so Haley, the next on my chart is to assess your hands. Can you stretch out your hands, please? I'll do both together. You can do one at a time. You can do both together. So I'm going to put pressure on both of your hands. Try to resist me. I'm just going to assess your hands now. Is that okay? So I'm putting pressure now. Try to resist me. All right, fantastic. Thank you very much. All right, so I can see your right hand and your left hand, they have normal power and your pupils are okay, they are reactive and the size is 3 millimeter. All right, can I assess your legs? And we're just going to do that one at a time, okay? So can you, let me use one of your legs. So good. Can you pop your slippers down for me? All right, fantastic. So I'm going to put pressure on your leg. Try to resist me. Oh, fantastic. Well done. Can I do same to the other? All right, putting pressure. Okay, well done, well done. That's fantastic. All right, fantastic. Well done, well done. So after chatting, please look at your chart to make sure you are not missing anything. All right, guys. So Haley, I've done a complete set of observations on you, and I can tell you you are having a GCS score of 14 out of 15. All right, so GCS of 14 out of 15 is not very bad. It's just because you are confused. And so the plan is I am going to be monitoring you according to NICE policy, which means I'm going to be monitoring you every 30 minutes. Is that okay?
All right.
Fantastic. So guys, is it that you have a GCS score of 14 out of 15 or you have a GCS of 15 out of 15? So whether you are having a GCS of 14 out of 15 or you are having a GCS of 15 out of 15, you have to monitor the patient every 30 minutes, all right, and escalate to the medical team. So Haley, I'll monitor you every 30 minutes like I said, and I will escalate to the medical team. Is that okay?
Okay, that's
fantastic. So Haley, I'm just now going to assess you according to the A to E assessment. Is that okay?
Okay.
So I'll be starting with the airway. For the airway, we have been interacting, and I can confirm your airway is patent. You are talking clearly. Or do you think you're having any obstruction to your airway?
No, I'm not.
Okay, fantastic. So I'll move over to breathing. For breathing, I did your respiration for complete 1 minute. There is no stridor. There is no visual sign of respiratory distress. There is no use of accessory muscles. There is no unusual entering of air. You are breathing all right. I'm happy with your breathing, and your respiration is 20. There is no distress of any form. I'm happy with that. All right.
Okay.
I also did your saturation, and you are saturating at 96 on room air. That's fantastic. Okay.
Okay.
I move over now to your circulation. For your circulation, I did your blood pressure, the one I tied the cuff on your arm, and your blood pressure was 110/50. That's within range, although it's quite low. I will escalate that to the doctors, okay?
Right.
Not very bad, but the doctors need to, assess you and see, all right? So I also did your pulse. I counted your pulse for 1 minute. The strength of your pulse, the rhythm of your pulse is okay. Your pulse is 80. It is within the normal range. I'm very happy with that, okay? So I also did your capillary refill. When I checked your neighbor, you are properly perfused. There is no cyanosis. I'm very happy with that, okay? So I move over to disability. When I asked you, do you know where you are? You were like you were in the supermarket, right? But now I know you know where you are now, okay? So I've oriented you to time, to place, and to person. So you know where you are. You now know the time of the day. We're in the afternoon, all right? I know you know where you are now. So I just want to ask you, are you having any pain? Because when I started your assessment, you drew my attention to the fact that you were having severe pain. Are you still having that pain?
Yes.
Okay, bless you. And if I ask you to score it again, is this still 0 being the least and 10 being the highest? What will be the score now?
I'm still 7.
Oh, it's still 7. Oh, bless you. Don't worry, I will escalate to the doctors promptly after my assessment, and we'll try and sort that pain out, probably by giving you an analgesic. All right? Can you take a deep breath for me again? Okay. Can you sit upright and let's now? Is it any way better?
No.
I'm so sorry, but don't worry, I'll escalate promptly. I'll just finish my assessment quickly. Can you still bear the pain for me, please? Okay. All right. So, Ellie, how is your urine output? Are you passing good amount of urine?
No.
What's the matter with your urine?
My urine is the color is like dark brown.
Okay, so do you feel pain below your abdomen when you pass in urine?
Yes, I feel pain.
Oh, bless you. It's probably there is an ongoing urinary tract infection. I'm not too sure. I'm not making any diagnosis, but I'm going to get you a sample bottle while you produce urine, and I will send it to the lab, and we'll see how it goes. Okay? Okay. All right. So, can I just also ask you, are you drinking well?
No, I'm not drinking well.
Oh, bless you. That explains why your urine might be dark. But I will encourage you to keep drinking well, okay? Are you eating well likewise?
I think I'm eating.
But it's just your drinking?
Yes.
That's fine. I could also refer you to the dietitian. It doesn't matter. Let them assess you, okay? If you are happy to. All right. So has anybody checked your blood glucose today at all?
No.
Nobody has checked your blood glucose. So it is important for your blood glucose to be checked. After my assessment, I'll come and check your blood glucose promptly, okay? Or probably if it has been checked, I'll have a look at your documents, okay? All right. Because you were quite not very oriented, but I know you now know where you are. So that's fine. I'm happy with that. So I'll move over to E. E is for your exposure. So for E, I did your temperature. Your temperature was 37. That's within the normal range. No further input is required for your temperature. But can I quickly ask you, do you have any wound any sore, any rash, any swelling, any breakdown in any part of your body at all?
No, no.
All right, that's fine. So, Haley, when I read your case notes, I saw that you are not compliant with your medication. Is that true?
Yeah, that's true.
Why have you not been taking your medications?
I don't want to take the medications because I don't want to take the medications, and my head is aching also.
Oh, you
So I
know,
don't feel like taking it.
I understand. I really understand your plight. But you know, it is really important for we get better. But if you're not taking your medication, that could explain why you fell. Because part of your medical history is that you have Parkinson's disease. And so because you're not taking your medication, your Parkinson medication, that's why you had a fall. Because the medication actually regulates your nerves, you know. But you're not taking it, so it's not doing the job. And that's why you had a fall, okay? So I'll encourage you. Because you're not taking your Parkinson meds, that may not be the exact reasons. I don't know if you get me, my darling.
Oh, yeah.
That may not be the exact, but because you're not taking it, it could be one of the reasons. Because Parkinson meds, you know, if you're not taking it, it's not doing its job, so it probably might prone you to fall. Okay, so please keep taking your medications. Are you happy for me to escalate to your doctor in charge of you that you're not taking your medication? All right, fantastic. So do you eat well? You know, we earlier talked about that, and you said you were not drinking well, but you're eating well. So I'll refer you to the dietitian. Okay, how about your mobility? How do you mobilize? I see from your scenario you use the Zimafrin. Is that correct?
Yeah, that's true.
All right. So I don't mind if you are happy for me to refer you to the occupational therapy just to reassess your mobility. What do you think?
Yeah, that's fine.
Okay, so I'll refer you to them. Are you all right with your mobility at the moment?
Just the headache, just the head that's
Oh,
aching.
that's
The
just the
issue.
problem, not even your mobility.
No.
All right, that's fine. Finally, one last question. Do you smoke or drink alcohol at
Yes,
all?
I do. I smoke.
Oh, bless you. How many packets of cigarettes do you smoke?
6.
6 packets. Do you think of quitting anytime soon?
No.
Okay, that's fine. So whenever you're ready to quit, just inform me and I'll refer you to the smoking cessation unit. Or you can refer any of the medical personnel and we can refer you to the smoking cessation unit and we can take it up from there. All right?
Okay.
So thank you very much for your cooperation. I really appreciate that. So I will try now to get you something for your pain. All right?
All right.
Thank you so much. So guys, make sure you check your charts to make sure you are not missing anything. And like I said, count your pulse for complete 2 minutes. Thank you for watching this video. Don't forget to give this video a thumbs up. Don't forget to subscribe to my channel and don't forget to like this video. I will see you in my next video. Thanks to my team for helping me. My lovely son is always helping me with videos, so thank you very much. I'll see you guys in my next video. And until I see you again, keep passing your all skills. I love you all, guys, and bye for now.